Here are some tips how you can take charge of your ejaculation and increase the volume of your ejaculate and maybe also your sperm count. My name is Stefan Buntrock and I'm a board-certified urologist and sexologist. So here are some basic facts that you have to be aware of. The prostate and the seminal vesicles are the structures responsible for 95% of your semen volume. I am using the word semen here so that you can follow along, although it would be more correct to say ejaculate or seminal fluid, because the semen itself, the sperm, is only produced in the testicles, and that is a small drop that's mixed with the seminal fluid at emission. Okay, that's another word you may not understand. At the end of the video, I will link one of my previous videos where I explain the basics of ejaculation. In ejaculation and orgasm, the pelvic floor muscles are enormously important. Involuntary contractions of the pelvic floor and, most importantly, the bulbospongiosus muscle are accompanied by the feeling of orgasm. Pelvic floor hyperactivity has been linked to premature ejaculation. So, if you want to control your orgasms and maintain or even increase your semen volume, you will have to take care of the anatomical structures involved. First of all, you want a healthy prostate and seminal vesicles. Research has shown that the heart and the prostate are related, as they are amenable to the same preventive strategies. In other words, what's good for the heart is also good for the prostate. The risk for benign prostatic hyperplasia, BPH, and associated symptoms is markedly reduced if you avoid obesity. A recent meta-analysis from 2023 found a strong relationship between non-alcoholic fatty liver disease resulting from the metabolic syndrome and benign prostatic hyperplasia and lower urinary tract symptoms, LUTS. Research has also shown that regular vigorous activity lowers your personal risk for BPH and LUTS. Furthermore, please keep in mind that the prostate is connected to the outer world. It surrounds the urethra just below the bladder neck, which makes it vulnerable to intruders from the outside. Unprotected sex with shifting partners poses a risk for sexually transmitted infections that may cause prostatitis. Unprotected anal sex means exposing the urinary tract to billions of E. coli and enterococci, with an increased risk that some of them will find their way all the way up into the prostate and seminal vesicles. The volume of seminal fluid is highly variable between ejaculations. Basically, you want your body to be sufficiently hydrated at all times, so drinking enough water will be the foundation. But semen volume is also dependent upon the time that has passed since the last ejaculation. You may have noticed that yourselves. The body has to produce new ejaculate first, which takes some time, so ejaculating daily or even several times daily will decrease the amount of seminal fluid per ejaculation. Resting between ejaculations for some days will fill up the reservoirs again. There are also indications that arousal has an influence. A very small study with 23 men found that semen volume and sperm quality increased significantly when exposed to a novel female. Another study found that staying sexually aroused for a longer period of time increased the number of motile sperm cells. Semen volume remained unaffected in that study. Then there is the pelvic floor. Training your bulbospongiosus muscle and pelvic floor will most likely result in three things. 1. When ejaculating through the air, you will be able to ejaculate farther. 30 to 60 centimeters is normal for a young man, 15 to 30 centimeters is normal for a middle-aged man. 2. The volume of the ejaculate will most likely increase because the muscle acts like a powerful pump. It expels the semen from the posterior urethra with contraction, and with relaxation, it sucks new ejaculate from the accessory glands. If the muscle is strong, suction will also be stronger, with the result of more ejaculate being expelled. 3. The feeling of orgasm is connected to these contractions. In older men, the contractions become weaker, so does the pleasurable experience that goes along with them. So when you strengthen your pelvic floor, orgasms become more intense. However, there's a catch. If you do it the wrong way, you will end up with an overactive pelvic floor, which will cause you pain and all sorts of discomfort, maybe even erectile dysfunction and a reduction in semen volume. As with all areas of the body, we don't want muscular imbalance with tight, shortened muscles, but muscular balance, where the muscles are strong, yet flexible and able to stretch to their full length. So Kegel exercises may not be the thing to do for most of you. In fact, according to my clinical experience, many men already have a tight pelvic floor, so something like reverse Kegels may be more appropriate. Training the pelvic floor is only possible if you know how to activate those muscles. If you think that this is easy, it is not. Half of women and 1/3 of men don't have a clue how to do it. Instead of performing a lifting action, they contract their buttocks or abs, or sometimes both. If you now want to know how to train, I will upload videos about it in the future. For now, here's that video about the physiology of ejaculations I promised you in the beginning. Thanks for watching. Bye-bye.